Good evening, everyone. Welcome to 360 Event Center. Coronavirus, Voice of Community, Day 9 today. Today we have exclusive guests and speakers with us. We have today Dr. Yadu Singh. Dr. Singh is a cardiologist and heart specialist, and we have guest Mr. Ajoy Ghosh. Ajoy is a welfare and community services worker. So we'll hear very important discussion today about the coronavirus, and Dr. Singh will be with us. So first of all, I'd like to go to Mr. Ajoy, just a quick introduction, and then he will introduce Dr. Singh. Thank you, Ajoy.
Hello, how are you?
Good, thanks, Ajoy. How are you?
Not too bad, not too bad. I'm very happy about the Event 360 Center to be here and talking to you guys today. Hope everyone will enjoy what we talk, and they will find out some important matters, what they really want to know about. So Dr. Singh is with us. He will tell us a bit more about this coronavirus.
Oh, okay. So coronavirus is a new virus which has jumped from animals to humans, and now it is a pandemic, which means really that it has gone to multiple countries in the world. It's everywhere. Literally every country in the world has coronavirus. Some are the biggest victims. Initially China, followed by South Korea, Japan, of course the United States, Europe, Italy, Spain, UK, Canada, Australia. I mean, every country is affected by this virus infection, and this virus is now officially, of course, is a pandemic, which means it's multiple countries involved. COVID-19 is a disease caused by coronavirus, and coronavirus is the organism which causes COVID-19. So one should not get confused. COVID-19 is a disease caused by coronavirus, and coronavirus is actually a pathogen or organism or a virus which causes the disease.
Okay. Dr. Singh, thanks about this, telling us the difference between what exactly the coronavirus and the COVID-19, because lots of people are pretty much confused about like whether these are two different things or what. Anyway, thanks for that. Other thing, what we want to know that how it spreads. There's a lot of talk about surface and air and all that. Can you a little bit give more explanation about this?
This coronavirus is a respiratory virus, so it affects predominantly lungs. That's how it actually causes disease, COVID-19. It is not different was the SARS, which was in 2002, which was a year later, I think, in the Middle East. So this is a respiratory virus which affects the lungs. So the secretions from the nose or the throat, they come out from the lungs, throat, nose, droplets come out of nose and throat and mouth, and they go in the air. And then they go for, some say, up to 2 meters, some say up to 1.5 meters. So they fly from the mouth or nose when we sneeze or cough and go there. And then if they go to our nose or mouth or even eyes, then the droplets which have virus in them from infected person. So this virus infected droplets from nose or mouth will go to the nose, mouth, or eyes of somebody who's not infected, and then will affect the cells in the nose and mouth and eyes, and will infect the person. And 80% people with this virus infection, which we test by swab or even blood test now, 80% of them have very, very mild symptoms: runny nose, sore throat, temperature. But then a small number have a symptom like breathing trouble, difficulty in breathing. And of course, the extreme difficult part of this spectrum of symptoms is pneumonia, viral pneumonia. And a small number of that will need support for oxygen. So it might be just ordinary oxygen through the mask, or in the worst situation, it may be respirator or ventilator. So infection spreads from the infected droplets from our nose and mouth through the sneeze or cough, and that's how it spreads.
Yeah.
It is not spreading from touch. For example, if somebody touches my skin, it may not go there. But if I'm sitting near a table and I sneeze and cough on the table, then droplets will sit there too. Or if I touch the table with my hands and then don't wash my hands, then I go and open the door. Or have the lift button, I press the button, or I open the car, or anything I touch after I have infected my hands from the infected droplets, then those things will also get infected. And if they will be a way to pass on the infections to if other people touch those things as well, like door handle, or the arms of the chairs, or tabletop, the lift button, and many other things. In if you go to transport, if you touch the railings in the bus, or so many things. So basically, the infection passes on from one to other through infected droplets.
Okay. One thing more I want to know about, like lots of people are a bit confused about, if we are sharing some food together and some saliva goes in somehow accidentally, will it affect in that manner? Or if there's any blood transfusion, it's not clear at all.
Well, the infected saliva, infected saliva will have virus, and they should not share food like that. So I would say that it's strongly not recommended to share food in that manner. So they should be eating separately, because saliva is the one which gives you droplets. So no, I would not go anywhere near sharing saliva or things like that. So no, that would not be good thing. Blood, I actually am not sure about that, because this is not a common known way that infection is spread from blood transfusion. There's no information. So I would say the way it spreads is infected droplets, not anything else. I do not believe it is spreading through sexual intercourse either. So I think infected droplets is the way it is spreading.
Now, if someone is getting infected with this disease, the symptoms are very close to common flu at the beginning.
Correct.
So initial stage, is anyone there like who can find out or differentiate like whether I'm getting infected or just the common?
Well, the symptoms are not very different from common flu. That's true. But here, there comes There are some few points, which is number one: if we have come from overseas, traveled from overseas within the last 2 weeks, 14 days, and we have those symptoms, as you mentioned, common flu symptoms, then we should be worried about possibly getting coronavirus. So that's one thing. Or if we have been in close contact with somebody who had proven infection, coronavirus, then we have symptoms like flu symptoms, then we should be worried about that as well. Or third, if we have gone to a hospital with pneumonia and nobody knows what this pneumonia is coming from, so this could be coronavirus, and routinely they are tested now. So that's three. And fourth, if we are healthcare workers, nurses, doctors, technicians, even cleaners in the hospital, and if we have symptoms like flu symptoms, we should be worried about coronavirus too, and they should also be tested. So not everybody with flu symptoms needs testing, but if they follow those 4 criteria, traveled from overseas in the last 14 days, have been in close contact with somebody with infection, proven infection, or they are healthcare workers and they have symptoms, the flu symptoms and fever, then they should be tested, and they should be asking their GP. Before going to GP, they should be talking with them first to alert them that I have these symptoms. They should not just present themselves to GP's practice, because doctors or hospitals for that matter, they have to prepare themselves to make sure that other people are properly covered and protected. So call them first before you go there.
Okay. Now, we all know is that prevention is better than cure. Right? And when any kind of symptoms are there, and we are going to see the doctor, but before that, to keep the preventions, and if that happens, what is basically suggested to keep or maintain a safer zone for the person, or other person shouldn't get affected? How
Yeah,
you...
so we talked about the symptoms. I think we should first also cover that there is a good chain here. There is no treatment. There is no specific treatment for COVID-19. There is no antibiotics. It's not bacteria, so there is no antibiotic. There is no antiviral medication either. There is no vaccine either. So the only treatment is supportive treatment, which means if we have temperature, we give paracetamol to suppress the temperature. If we have respiratory problem, breathing trouble, we give them oxygen. And if you need support with ventilator or respirator, then they go to ICU, intensive care unit, to have ventilator and respirator. So treatment is supportive. There is no specific treatment, antiviral treatment, and there is no vaccine. That's why, coming to your question, that is why it is important that we should do everything to stop the chance of getting infected and to stop the chance of infecting others. So that is what prevention is. In that one, what we have to do is to follow the rules of good personal hygiene and follow the rules of social distancing. Now, personal hygiene. We should wash our hands with soap and water for 20 seconds, minimum 20 seconds, and frequently. So suppose I'm sitting here, I touch the table. Now, before I go anywhere, I will go to the wash basin and wash my hands for 20 seconds. Now, whenever we touch anything with our hands, wash them with soap and water. That's number one. Number two, because there is a chance that my hands may have got droplets, which may come from anybody who has infection. Now, those droplets in my hand can go to my nose or mouth or eyes, so that means I should not touch my face. I should not touch my face with my hands at all. And number three, no unnecessary contact with anybody else, which means no handshaking, no social kiss, no hugging, and we should just do from a distance, namaste or salam or air waving. So we should not have unnecessary contact with anybody else. That's number three. And number four, when we are sick with flu-type symptoms, even, we should not go out in the public. We should be staying at home because there's always a risk that we have infection. We should not be passing on to others. So these are the things which basically are about the good personal hygiene. So not only that, so when we have washed our hands, it was all good, but we should also be disinfecting the surface of the tables, arms of the chairs, door handles, and even the car keys or the wallet with the proper disinfectant. And they are commercially available in plenty. So we should be cleaning them too. So the top of the table, armchairs, door handles, car keys, wallet, all those things. So we should just accept one thing, that our hands and everything around us, tabletop and whatnot, may be infected. So we should wash our hands, not touch our face, and disinfect the top of the table. That's what we should do. Now that is personal hygiene. Now when we are coughing, one more thing is hygiene. When we are coughing, and sometimes we cough, when we are coughing or sneezing, we should cover our nose and mouth with tissue paper and then dispose of the tissue paper thoroughly in a nice bin. Now, if we do not have tissue paper, and we need to cough, sometimes you can't stop the cough, and sometimes you can't stop the sneezing. What you should do is to bend your elbow, bring it close to your mouth and nose, and sneeze or cough into the elbow. That's if you don't have tissue papers. And after that, you find a place where you can wash your elbow with the soap and water. So these are the personal hygiene things. Now, social distancing. Social distancing, or you call it social zone, but actually the real word is social distancing, which means we should keep a distance from everybody else. So no going to any events, no going to any crowds. In New South Wales, it's 2 people. You can't meet more than 2 people in any public place. So not going to crowd, not going to events, and if you have to go somewhere, even you're walking at a footpath, or you're going anywhere, even bus or train, have a distance of minimum 1.5 meters. 1.5 meters from me to other person. And if I go to a place, for example, right now the barbers are open. If I go there, they are supposed to have one person in a 4 square meter gap. So 4 square meter. So we need to keep a big distance from other people so that our droplets do not go to others and their droplets do not come to us. And particularly one more group. I say those people who are 70 plus, those people who are 70 plus, they are more prone to catch infection. They are more prone to have bad outcome from infection. So we should avoid visiting them. They may be our father or mother or grandparents. Avoid going to them. Do not go there. That's number one. Number two, do not visit any nursing home or aged care facility because elderly people are there. And as I mentioned before, they are more prone to get infected. And if they get infected, they are more prone to have worse outcome too. So that's one thing. So these are the things which we call social distancing. We need to, and of course, now the rules here in Australia are that if you do not need to go out, do not go out. You can be and you are being fined. So we need to follow the rules, regulations in regards to social distancing. And if you are not sure, if people are not sure, please go to Google. And depending on where you are, you may be in India, you may be in Bangladesh, you may be in Sydney, you may be in Melbourne. Please search in Google social distancing rules in my city and follow them. It is for our interest, it is for our health, and it's for the health of our people around us. So we need to be socially responsible. We need to understand the meaning of civic responsibility to behave and act as responsible people to not only help us, but help others as well. Now, what actually is the purpose of this social distancing and personal hygiene, Ajay? See, if infection is happening, now right now in New South Wales, in Australia, we have 6,000 people infected. We have 50 deaths. In the whole world, we have 1.4 million people infected and 82 plus thousand people who have died. Now, it's a huge problem. It's a big problem. Now, what we have to do is, if we don't do social hygiene, personal hygiene and social distancing, the infection, people who are getting infected, the peak will come like this, boom, like sort of a rocket. And number of people, as you know, some people will get severe form of disease where they will need to go to ICU. The number of people, those who are getting infected, suppose there are 1 million people infected. I'm just giving a number. Now, quite a significant number of that, say 10% of that or 5% of that would need to go to hospital. That's a huge number. The ICU beds would not be there, respirators would not be there, we would not have the beds in the hospital, we would not have doctors and nurses to look after them. So that is why it is important that the peak of this infected people should be growing up slowly or actually not growing at all, but the peak should not happen like this, like boom. It should be happening slow, almost like aeroplane going slowly. So we need to flatten the curve so that the system is there with enough beds, doctors, nurses, respirators, ICU beds, and whatever support system to be able to help us when we need that help in the hospital. And luckily in Australia, particularly in New South Wales, in the whole Australia, the curve has been growing slowly, and we have not allowed a peak to come up very quickly, and that's a great result. And congratulations goes to actually people in Australia. They have been responsible. Some people are still not following the rules of hygiene and distancing, but majority, big numbers are following it, and congratulations to Australians particularly.
Yeah, Doctor, you just spoke about we don't have any medicine so far. But in recent days, 24 hours ago, there was a bit of noise around the world that some US is talking about, to India and all that for some medicines and all. So if that happened, there are two things about. If that happened, what will happen? It is not proven yet, so you know better exactly more than me about. And secondly, we have seen in recent past when this COVID was introduced or came into market, that people were just going into shops and market and buying all the things, stocking all the things. If this kind of any medicine comes up in the market, we might be found something like that again. Will it be controlled selling by the government to the affected people only, or people can just go and buy it? What do you think? What's your opinion about that?
Well, you're talking about hydroxychloroquine. Hydroxychloroquine, which has been in the news, and President Trump called Prime Minister Modi, and India had banned the export, but he requested India to not stop the consignment or export of hydroxychloroquine to America. India has allowed that to go. Now, hydroxychloroquine is a medicine which is used in rheumatoid arthritis, lupus, and so many other immune conditions. So it's available. But remember, people can't go and buy it because it is a prescription medicine. It has to, people will need to get the script to buy this. Number one. Number two, so people just can't go to Harris Park and buy it because it's not available unless someone is selling it. So number one. Number two, this medication or medicine has not yet been proven to work. There was a research paper from France 5 or 6 weeks ago, and they published some great results, but it was not found to be corroborated later on in one other paper. So it is controversial. It is not well proven. There are some support that it may work. So until it has been found to be working, I would not be saying it works. Remember, there are many things tried at the moment. A lot of things are being tried at the moment in various hospitals in China, in America, Spain, UK. Until we have a clear proof of their effectivity, efficacy, we don't know. President Trump always goes on exaggeration, and he always says, I had great talk, I had a huge talk. You know, he talks like that. So I don't know whether we can give too much importance to what Mr. Trump has said, but I hope it works. And India produces 70% of the hydroxychloroquine. So whole world supply, 70% comes from India. I hope it works, and I would be happy to hear that, but we do not have a conclusive proof at the moment. That's about medicine. About the grocery you mentioned, people are going. Look, Australia has sufficient supply of grocery products in this country. We do not need to rush to the shopping centers, grocery stores to hoard, collect all the toilet papers, all the rice, all the dal, all the tuna. That's crazy. We should not do it because that's selfish. It's not good. We should actually behave responsibly. We have not done it. In our family, we have not gone to shopping centers and buy things in mass scale and hoard it. I know some people have bought them in big numbers to do marketing so that they can make money. I got contacted by some people saying he has sanitizer. Sorry, we forgot to mention one thing before I continue. If you don't have soap and water nearby, you should be able to have the hand sanitizer, alcohol-based, and you should sanitize your hands, which is second best compared to soap and water. So going back to the buying, I would not encourage people to buy things in mass scale and do hoarding because some people are selling. I got a call from somebody in Sydney that he has probably about 50,000 masks, and he has about close to about 10,000 hand sanitizer bottles, and do I want to buy it? And I just asked him, how did you get all those things? He said, I'm a businessman. I went to places, I bought it. Now, I'm not going to buy from them for one reason. I do not like this because it's not a very good thing. It's irresponsible. Doctors, nurses don't have this mask and those things. And this fellow he's doing profiteering. You know, he's selling at a high cost. It's very bad behavior. So I recommend, please, the people who need to have these facilities more than anybody else, masks, etc., are the doctors, nurses, and people who work in the hospitals and GP practice and doctors practice. So we should not be doing this. And if you have bought them, become a nice human being. Your God will fix you up if you achieve profit during this time. What you should do, accept that you have made a mistake and return it back to wherever you bought it from. Give it back to them because you will get a lot of punya. You probably will go very close to your God, whichever God you believe in, maybe Vaheguru, maybe Allah, maybe Bhagwan Ram. It doesn't matter, or Jesus Christ. Do not do some crazy thing. Return them to people from where you bought.
Now, Doctor, one last question about, especially for the students. We have lots of students from overseas over here, especially from India and China and other Asian countries. The government has changed its stance and asked them to go back to home if they can't afford themselves to stay over here because universities are closed. Now, lots of students are living together to save some money. They are living in shared accommodations and their facilities are limited with that, using 1 or 2 toilets, maybe 6 or 7 of them living together. So community is helping them with food and other things. What you have to say regarding this? How
If
they
they
can
are,
keep themselves
if they are
alive?
living in a, yeah, if they are living in a shared house, they're not sharing the bed, right? So they are living in a room, one room to one person, right? So they have to practice good personal hygiene and social distancing, which means when somebody coming out of his or her room and they're going to toilet, they should make sure they have communication and they should go to toilet, not, with a gap, like, there shouldn't be meeting and mixing. That's number one. Number two, after using a toilet or bathroom, for that matter, they should clean it. There should be disinfecting. They should clean that toilet seat and everything else. And so again, same thing. If you go there, you are touching the doorknob, you should just basically use the hand washing, soap and water, or hand sanitizer. Just follow social distancing and good personal hygiene. That's number one. Number two, if you are cooking something, don't gather more than one person. So have a roster. Okay, 10 to 10:30, I will make my Maggi or vegetables, or I'll heat my Lebanese bread. So and then 10 to 10:30 to 11, I will do that. So just don't go in any place in your shared house more than one person. That's number one. Number two, I know there's a problem in supply of groceries and all those things for students, which is a problem, and that is where they should first make a roster themselves that one person will go to shopping center and buy everything for everybody, and we as community members should also help them, no doubt about that, as much as we can, within our limits, within our resources. The third thing about the Prime Minister saying that if you can't afford to live here, you should go home. What Prime Minister said is this: there are people who are on tourist visa here, and if they are in trouble, they should think about going home, which is not a bad advice. But I know at the moment many countries have banned all the flights. India is one of them, so they can't actually go back to India right now. But students of them, in the first year, before they got the visa, Ajay, they gave an underwriting that they have money for rent, fees, and food for 1 year. Yeah. And job or no job, they have the money, they have the backup, and they have to show that money, bank statement. So for first year, they shouldn't be in trouble because they have shown the evidence that they are not going to be in trouble. Beyond first year, I know many of them depend on the jobs. The jobs are generally in restaurants or somewhere else. I know it's a problem for them, no doubt about it. Some of them are in trouble. But remember, many people like you and I also in trouble. So Australia has to give priority to its citizens and permanent residents before anybody else. Now, because we run a group called Federation of Indian Associations of New South Wales and other federations in this country, Canberra, Melbourne, Perth, Western Australia, South Australia, and Queensland, and Melbourne, we all have been working. We have submitted a combined paper to government and premiers, requesting and suggesting to them that there are ways you can help these students. Number one, first of all, the rules are that they can't be evicted at the moment. 6 months, nobody can evict them. That's number one. But they have to pay the fees later on, rent later on. But at the moment, they can't be evicted. That's number one. Number two, we have requested the government to basically ask the universities to cut down the fees because they're not going to classes. They're learning, if at all, they're learning through the digital media. So fees should be less. So we have recommended that as well. Number three, that if they have to go to India, rules are that you can't go to India during your course time for more than 1 week, right? So we have recommended that if they go to their own country, China, India, whichever country, the visa rules should be changed as well. And we also have recommended that they should be given some financial support because, and there are many other things, because the education sector from overseas students is about $38 billion a year, $38 billion a year, and there are total about 580,000 students. Out of them, 86,000 are from India. I don't know about the Bangladesh or Pakistan or other countries, but I know 580,000 total students here. Out of that, 86 are from India. Okay. So there are ways to help them. We should help them with the food, which we are doing, by the way. The community has come up to the plate and they're helping. So that's a great, noble thing by our own community and Chinese community as well, every community for that matter. Now, they did not know, we did not know, government did not know there will be coronavirus pandemic. Now, they are all stuck. They're all in trouble because of some unknown, unexpected thing. So it is the job of every human, government included, to help them as much as possible and doable.
Now, one thing, about which I think very few people have talked about this, about the moms who are breastfeeding moms and all that. What the moms, the mother, the breastfeeding mothers?
Okay.
Yeah, no one talked about that. I mean, not many people have talked about that. I just want to know for those people who have little babies who are still breastfeeding, if there's any advice about it.
See, this virus is affecting and causing a lot of trouble for people who are 70 years plus, or if they are 60 years plus but have chronic disease like heart disease, diabetes, hypertension, like lung disease, or they are immunocompromised. So this group is more at risk. That's number one. So 60 plus and chronic disease, or 70 plus just by age, or somebody less than 2 years of age. So these two spectrum are in more risk. I would say that people who are in that category, very, very young kids and very, very old people, they should be practicing social distancing in a big way. And in fact, the pregnant ladies, they should be staying away from anything where they can get infected. Now, there's nothing special about any of these two groups. They just have to follow the social distancing and good personal hygiene. There are, in this country and all over the world. Now, there was a data saying that most people who are dying are above 70, which is true even now. But there are a lot of younger people in 30s, 40s, 50s, and even some younger than that. They also have gone to ICU, and they are in ICU and having treatment. But the data today is that the deaths which is happening, that's happening mostly among people who are 75 plus. And don't forget, the Prime Minister of UK, Mr. Boris Johnson, he's only 55-year-old, and he's in big trouble. He is now in ICU, intensive care unit, because he was having trouble with oxygen. So he's getting pneumonia and problem. And I pray to God that he is saved, because the Prime Minister of a country is in this big trouble, and I just pray that he survives. So what I will say, that please forget about the pregnant ladies or this one or that. Everybody can get infection, and everybody can get pneumonia, and everybody can get the worst outcome, which is death. Please practice good personal hygiene, which we talked about, and practice social distancing to not only save yourself from getting infected, but very importantly, you need to save others around you or in the community from getting infected. That is our social responsibility. That is, and we need to do this. And please don't be silly and idiotic and moronic to imagine that you are invincible and you won't be infected. Don't do that. No parties, no, of course, clubs are closed, restaurants are closed, pubs are closed. That's all good. But please do not invite people to your home. Don't go to somebody's home and don't invite them to your home. Live in social distancing parameters.
Right. Now,
yes. Just before you ask me a question, yes, I am currently practicing as a cardiologist in Sydney, but I actually have background in immunology and infectious diseases. I came from India so many years ago, and I was registrar in immunology department in Prince of Wales and John Hunter Hospital in Newcastle. So I came from India because I was already training in immunology. I worked here for a few years, and then I stopped enjoying immunology, infectious disease, so I moved to cardiology. So yes, I have got great interest in this area, and not only that, my brother, I also went to CDC, Centers for Disease Control and Prevention in Atlanta, USA, which is the top body of this area, and I trained there for a couple of months. And not only that, I've also been to WHO Geneva from India, from New Delhi, because I did a lot of work on HIV, infectious disease, and I was there as a temporary advisor twice in WHO Geneva, and they paid me money too, which was very good. So your question.
Thank you, Dr. Singh. My question was, we know that this is a pandemic situation. Everyone knows what is coronavirus. Specific question, how actually this virus attacking so quickly, so people, they are collapsing or their respiratory system getting impacted?
Yeah, three things I will say here. Number one, nobody has the immunity to this virus because it's a new virus. Nobody has the immunity. They have never been exposed. So when it attacks us, we don't have immunity. So it all depends on how good is my own immune system to be able to resist this virus. That's number one. So because there is no immunity, you or me or anybody, so when we get the virus, the only thing which protects us to some extent with mild symptoms is our own immune system. That's number one. Number two, what happens is when the virus gets entry into our body, as I said, this is a virus which is basically a respiratory virus. So it goes to lungs, and in the lungs, the body immune system starts fighting with macrophages, cytokines, all the hormones. So body creates the fighting system, and the fighting system to fight the virus, it leads to some inflammation in the lungs. So those air pockets which get the oxygen from air to our body, that pocket system called alveoli, that alveoli gets filled with the cytokines, cells and fluid. So those places where the oxygen can be taken to the body is full or filled with fluid and cells. So we don't have much to get oxygen into our system. So that is what is happening. It's leading to something called ARDS, acute respiratory distress syndrome, which leads to respiratory failure, and that is when we need the ventilator. So because nobody understands what is happening, why it is causing to, why some people are getting into that problem and some are not, that's not clear. And in fact, I've seen a paper or research, preliminary research, saying that we need to control the inflammation in the lungs, because that is the basic reason why lungs are failing. Because once lungs fail, then whole body organs start failing. Now we call that multi-organ failure. So there is a thought process going on that maybe the doctors in the hospital and ICU should control the inflammation with proper anti-inflammatory medications. It's not proven, but that's a thought process. So that's the reason why people are getting into respiratory failure, multi-organ failure, because of the defense system coming to our aid, our support, and then giving some byproduct, which is very harmful to the lungs.
All right, thank you, doctor. Thank you for coming over here and spending your time. Before we leave, I give two numbers to the people. One is for the moms who are young moms with the young bubs. The number is 1-800-686-268. It's 1-800-686-268. That's a helpline. If you have any problem, you can call to them. Another number is 1-800-022-222. 1-800-022-222. This is for the people who have been just recently traveled, came back over here, and if they are feeling that they have any symptoms, they can call their doctor or directly on this number. This is once again 1-800-022-222.
And before we go, Ajay and my friend, the 60 event, Attabur, and let me tell you, there is a lot of information, or I call that misinformation, coming through WhatsApp. Yeah. And a lot of information coming through Facebook. I urge people to not give too much importance to what you are getting from WhatsApp. There are a lot of people claiming this cure, that cure, this thing, that thing, rinse your throat, drink hot water, so much, or drink even Listerine. I would urge people to ignore this nonsense misinformation from WhatsApp and social media. Please, depending on which country you are in. In Australia, we have a very authentic body called Health Department of the government, which is www.health.gov.au, and we have something similar in New South Wales, every state. Please go to only authentic, authoritative website for information. Certainly not going to WhatsApp to learn nonsense and misinformation. That way, we would act as responsible citizens and who have full understanding of our civic responsibilities. That's what I would say.
Exactly. Thank you for coming over here once again, and we wish everyone to be in a safe zone and behave safely and keep your family, your friend, your society in a safe practice mode, and be happy, be healthy. Thank you.
Stay well and stay safe. Thank you very much, Ajay. Thank you very much, Attabur. Thank you.
Thank you, doctor. Thanks.
Thank you, ladies and gentlemen. You are hearing Dr. Yadu Singh and Mr. Ajoy Ghosh. That was a very fantastic and informative session we had from Dr. Singh. Thank you very much, Dr. Singh, being with us, and thank you, Mr. Ghosh, to be with us. Ladies and gentlemen, we'll be having more and more session about coronavirus and the crisis we are dealing with. Keep an eye on our page 360 Event Center. We have multiple events set up already. Visit our web pages or the Facebook page for the next events. And we hope that Dr. Singh and Mr. Ghosh will come with more and more information, which will be crucial. And we know that we are going to hit the peak, if not in Australia, but definitely in other country, maybe in back home. So keep an eye, stay well, be safe, keep the social distance, pray for all, and be safe. Thank you. Have a good night.
Thank you very much. Pleasure to be in this program. Thank you.
Thank you, Dr. Singh. Thank you, Mr. Ghosh.
Thank you. Thanks, everyone.